Good morning, everyone. So it is a pleasure to start with this twinning webinar. So this is Brazil, Peru, security and responsible management of biological material. This event is organized by the biosecurity director of the investigation of the Peruvian University, UPCH, the Fiocruz Uni, the University of the South. So this webinar is part of the cooperation strategy, Brazil, Peru. That's what we're going to listen to in some of the presentations here. So this is to help the exchange between the institutions of all the institutions here. So the idea of this event is to make it known and promote the mutual learning in topics as biobanks and the management of biological issues. With this space, we want to share knowledge, experience, and good practice that will contribute to reinforce the institutional capacity and the capacity building of staff and the responsible use of biological material during investigations. So the experience of Fiocruz, that is a leading institution in the region, offers a solid framework to think about security standards, regulatory frameworks, access to samples, and sustainability of biobanks. And given the Peruvian institutions, they are giving their local perspectives and the advancements in the management of their biobanks. Today, we're going to have the participation of professionals that will share their knowledge and experience concerning the importance of biobanks and their correct implementation. The event will be developed in 2 blocks of presentations, and at the end of each block, we're going to have a space to answer questions. So the first is dedicated to the presentation of Global Health Network, Latin America and the Caribbean. This is a project developed in the framework of the collaboration Brazil-Peru. And then we are going to have Dr. Ernesto Raul Cafarena, researcher of Fiocruz, and Dr. Cafarena will give us an introduction to the Global Health Network, Latin America and the Caribbean, and he will talk about what is twinning, presenting the institutions that are engaged in this opportunity between Fiocruz and Peru. Then we're going to have the projects that are developed within this cooperation framework, TGHN LAC, Brazil, Peru. And then myself, I will present the project of the biobank culture Brazil, Peru. So we're going to share perceptions, remarks concerning the development of biobank in both countries. Then we're going to have Fernando Miguel Runza Comenares. So this is the responsible for the med school in the Scientific University of the South, UCSUR. And then they will also analyze the biobanks in the region through a bibliometric and focus. Once both presentations are finalized, then we're going to have the first questions, and then we are going to reply the questions of all of them. Then we're going to start with the second block that is focused on the presentation of experiences related to the management of biobanks. So those specialists that will share practical cases in the Latin American case. Then we are going to start with the participation IR, Francisco Sartorio of Biobanks, and the Vice Presidency of Biological Collections of Fiocruz that will talk about this. So then we are going to have the technical components to establish the biobank. Then we have biolog Era Chanterrera from UPCH is going to talk about the foundation and good practice in the management of biobanks with an emphasis in the biosecurity issues. So this is a pillar of responsible management. Then Dr. Cristiane Campelo, researcher of the Fiocruz, will share her experience with the presentation, the use of the RedCap platform in the Fiocruz network of biobanks. At the end of this block, we're going to have a space for questions and answers, you are, and then we're going to have consultations for everyone. So before starting the first presentation, I would like to thank each one of you for following us in this morning. So your participation reflects a commitment shared to reinforce the responsible management of biological issues in both institutions and also sponsor a culture of biosecurity and cooperation in the region. We hope that this space will contribute to the development of technical competences and the development of joint initiatives that will help all communities. So now we would like to start the presentations of the first block. Thank you very much. Thank you very much, Cynthia. I'm not sure if I can already. Very well. So good morning, everyone. It's a pleasure to be today in Lima, Peru, to talk a little bit about the relation that was established between Fiocruz and the University Cayetano Heredia, with the participation of the Scientific University of the South to create a twinning in terms of biobanks. So in terms of context, I am going to talk a bit about how the Global Health Network was done in 2018, and then what is the goal of such network? This is a knowledge-based open community where knowledge is shared related to different diseases, where different organizations take part. But what's the main goal of this network? This is to share with equity, knowledge, and research methods in all the sanitary frameworks that will give benefit to everyone in the network of health. So how is it done? So we reinforce the investigation systems that are already integrated using the resources that are available in the internet and offering capacity building in terms of resources. So what's the main goal? What's the result that we are looking for here? It is to integrate the assistential practice and develop at the same time research teams so that everyone can have access to that. So if you have access to the web page of the Global Health Network, you will see something that looks like this. And the Global Health Network has to do with a decentralized network, and it's based on 4 important points of Africa, Middle East, and North Africa, Asia, and in this case, Latin America and the Caribbean. So based on this, we have here something that works with 6 centers in the region, including Argentina, Brazil, Peru, Colombia, Honduras, and the Dominican Republic, with the participation of research institutes, each one of them with their specificities, with their specific issues, but all of them focused on the study of public health and the betterment of public health. So the mission of TGHN, the Global Health Network, is to reinforce the research into health and knowledge exchange. Of course, data will bring up such concepts again throughout the conversation here, because it's important to make it clear. Our goal is to make it more popular access to knowledge and such resources. So what are the goals that we want to achieve? Collaborate. So everyone, all the population in the Latin America and the Caribbean have access to the best health practices, regardless of their geographic location. On the other hand, we would like to use that to such collaborative network to exchange ideas and experiences. So here you can see the website, TGHN Latin America and the Caribbean LAC. So here we see some data that are cumulative of this year, and you can see the number of visitors, Latin America and the Caribbean, concerning Africa, Asia, and so on and so forth. So what are the activities now that are developed in TH, in the Global Health Network in Latin America and the Caribbean? So many axes, some of them related to the scientific regulation, for example, including here webinars such as this one, workshops, learning sessions, guided learning sessions, and capacity building such as mentorships, as well as discussions of clinical data, club formation, that's for researchers, and something that is more related to process such as, for example, the establishment of twinnings, which is collaboration between institutions, cooperation between institutions, and some, as I said, that, for example, the organization of projects pathfinders, projects that will investigate other things. So this is a good universe with possibilities to have exchange of ideas and collaboration. In particular here, the twinning program between Brazil and Peru came up as a result of this institutional cooperation between both institutions for a collaboration between institutions, hospital networks, with an aim to promote alliances, reinforce investigation capacity, exchange knowledge, resources, experiences, and joint learning, as well as exploring new investigation opportunities. So we can do things better when we are collaborating with other people, other ideas, other institutions. So one of the goals of our objective here also is to untap new possibilities of research. And in this case, this international cooperation, it was done between, as Dr. Cynthia has already explained, the Peruvian University Cayetano Heredia, and the collaboration of the Scientific University of the South, UCSUR, and concerning the activities that have been developed since the inception of this collaboration. There was the validation of the Spanish translation of these standardized operational procedures. So 2 online seminars about the management and of biobanks, FIOCRIS, with all its experience concerning the topic, and the hybrid seminar as a result of the twinning Peru, and the Cayetano Heredia University dealing with this biosecurity, responsible management of biological material. As a result of such exchange, there is this club of exchange to share ideas and outline possibilities of cooperation or joint operations. So the next items, for example, diagnosis banks and bibliography literature review, they are already underway, and they will be brought up in the next speeches. And now here, those that are taking part here, is there anyone that has an interest in infectious diseases? Well, if there is, you can take part in the network that is illustrated here on this map. So here you can see some pings, and those who would like to participate can apply the data so that they can be part of this global network. And it has to do with this procedure. So you can publish a form, I'd say for free without any kind of commitment. You can use the map to identify regions that are already collaborating and that offer resources so that people can use them. So there is a QR code here. You can have easy access to the map here. The second part here of this presentation is to show the possibilities in Fiocruz Foundation. This is an institution, federal institution in the Republic of Brazil, 125 years of trajectory. It's under the Ministry of Health. It was founded by this sanitarist, Dr. Osvaldo Cruz, working in collaboration with Carlos Chagas. You can see here the pic on the left corner down here the screen, and there are other older pics showing here, for example, a technician preparing a tetanus vaccination 1963, or even against smallpox here on the left. And of course here in the middle, the presence of Einstein in Fiocruz in 1925. So we had the illustrious visit of this researcher in the institution. So this is a strategic institutions for the country. There are several possibilities of activity, and all of these centers of activities are interconnected concerning research, development, learning, education, services, health services, with reference to hospitals and ambulatory services, the production of vaccines, diagnosis, work in environment and health. So they also have this history that has to do with the heritage that is studied here. And we also have a sector for communication and information that is essential to share actions of the Osvaldo Cruz Foundation. So something else that is important here that promotes the participation of the community, giving capacity building to people, specialized people in health that carry out some surveillance tasks. So these are people of the community that interact with people from the community. So this is an institution. You can see here, given the figures here, that this is a big institution. So it is distributed in 11 states out of the 27 states in Brazil. So we have almost 14,000 people working, and almost 4,300 are public civil servants. So we have our activities distributed in 4 main axes. First has to do with research data. So some of them. The second one has to do with the production of vaccinations, and the third one here, the third column, has to do with the master's degree and PhD programs. And the last one here has to do with the patients, hospitals, and everything that will be there. So among the activities that are there, so you can see that they are all interconnected. And there are several disciplines here, for example, pharmacology, veterinary, and human medicine. So biotechnology, for example, maybe this is the most important here, public health. And there are others like, for example, history of science and health, as interdisciplinary things as well.
Regarding the development of innovations, okay, we are doing investigation, multidisciplinary investigation that we have, and the Fiocruz Biodata Bank, okay. This is part of the investigation. We have a center for the assessment of alternative solutions, okay? 35 biological collections. We have a genomic network of Fiocruz and 74 technological platforms spread out throughout the entire country, okay? And we're going to discuss this a little further down my presentation, okay? And so this slide is very, very important. And it talks about how we are spread out, okay? We can be found all over the world. And this is part of the cooperation centers from the WHO and also from PAHO. And we have reference labs, okay, for COVID-19, influenza, among other viruses. It's important to mention the regional center for Latin America, okay? We also have a center for the production of vaccines in Latin America and the Caribbean. And we also have an international network of human milk, okay? And you can see also the green triangles. They represented the World Network of Human Milk Banks, okay? And in purple, we have the network of public health schools within Latin America. They implement activities and initiatives, okay? And also, we also have, just to give you an idea, so if you have the intention to cooperate with us, we have some potential lines of cooperation so that you can work with Fiocruz. You also have with Latin American Caribbean, how via the organization of virtual scientific seminars among the institutions, participation of professors or researchers remotely in our regular courses, okay, traditional courses. And you can also do your PhD here at Fiocruz. We can also organize joint seminars online so that we can have a national internationalization, okay? And you should pay attention to the calls that we have for academic mobility, okay? For institutions or for individuals. If you require further information, you can get in touch with the TGHN, Latin American and Caribbean. You can use the QR code. For your attention. Thank you very much. And I'm open to questions that you may have. Thank you very much. Thank you very much, Mr. Ernesto. Let's continue with the presentations now. Can you see my screen well? Yes. Excellent. Thank you. So now I'm going to give you my presentation. I'm going to talk about the investigation of the Brazil-Peru biobank culture. And this is being carried out within the twinning. I have seen the explanation given by Ernesto in this initiative. My name is Cynthia Hurtado. I'm the Director of Regulatory Matters. Let's talk about biobanks, a project on biobanks. So it's important for us to understand certain concepts that are basic for those who still are in doubt about them. and the context in which Peru finds itself. So a biobank becomes an entity that can be public or private, and it's going to receive or process or store or distribute one or more collections of biological samples with their associated data with the purpose of being used for researchers. And so a donor can sign an informed consent form. And then for research matters, this is essential and indispensable. It's important for the donor to accept the use of his or her samples, okay? So these samples can be processed, okay? They can be stored in a biobank, and they can be used to do these researches in the future. And we follow all of biosafety rules, quality control. And so in order to do that, we have an international regulation regarding that. It's an ISO and different international organizations, and we have created guides, guidelines, standards so that we can bring biosecurity, ethics, and safety to these processes. So we have some international topics regarding human health. And we also have a specific agenda for that, agenda number 11, that talks about the collection of these samples, their storage, the use of biological materials. And we also have other guides and practices such as ISBIR, which is the International Society for the Storage of Biomaterials. And we also have best practices, recommendations for biobanks, and we have issued its 5th edition. We also have ISO 20387 so that we can ensure the management, the quality of the biobanks. We also have OECD, which is the Organization for Economic Development. So all of these norms, rules, and guidelines, they offer to us operational, ethical operations and guidelines, how we can distribute the biological samples, ensuring the traceability of these samples. So it's important to have this traceability so that we can maintain the quality. And quickly, I would like to give you a brief overview of what would be the regulatory scenario or a sound regulatory scenario. Okay, differently from Peru, Brazil has this committee, the National Committee on Research Ethics, okay? And they oversee the biobanks that are operational in Brazil. And they are related to the storaging of these samples with informed consent from the individuals, with privacy, with autonomy, and the responsible use of these samples. We have 2 resolutions that are very important that were issued in 2011, one from the National Health Council that defines the concept of what would be a biobank in order for us to carry out scientific research. Another one is an ordinance created by the Ministry of Health, also issued in 2011. It regulates technical aspects, administrative aspects for these biobanks, and also how they can store human samples. In Peru, the situation is a bit different. Peru still needs a sound regulatory framework, and we are now taking steps, initial steps, so we still don't have a national framework. We had some efforts in 2012, okay, and this was boosted by the National Health Institute, but we still haven't had a final say in the matter, okay? And we can emphasize some relevant experiences. The first one is the National Tumor Bank from the Neoplastic Disease Institute that was created in 2008. They were the first one to formalize everything, how to use oncological samples. And the donors, they have had different kinds of cancer, and they also aim to support clinical and oncology research. In 2009, the oncology college, okay, which is a college that is very important in our country, and they have their human teeth banks. They have extracted these teeth from patients, and more currently we have the DNA biobank from the INCN. And this biobank is the bank that we have with samples that come from patients who have multiple sclerosis or other diseases. And this is an important step to take for genomic studies. We also have the contributions from neurological researchers in the country. In 2024, we had an important milestone because we opened up the National Tumor Bank. It's called INEN, and we received 20,000 samples regarding 6,000 cases, and with a capacity to receive 150,000, and it is integrated to the World Biobank Network from the WHO. And we also had the first international conference on biobanks in Lima. And we had the participation of the WHO and also the participation of France and other Latin American countries. And INEM is being a pioneer in the management of biobanks in our country. We also have established biobanks in Trujillo, Junín, and Arequipa. So now let's start showing the situation of the university. The university, it has been doing these studies since 2006. As time went by, they have already carried out over 27 clinical trials, okay? They approve about 200 research projects every year, and many of them include the future use of samples for research, okay? With the informed consent of the individual and other documents, okay? And we also have biosecurity and safety, okay? It's organized by the UPCH jointly with Fiocruz from Brazil. We also have international cooperation, and we have created the Research Biobank Club, okay? This started in the 1990s, but it never had the intention of being a large organization with traceability, with a digitalized system. But the projects of these researchers, they have ultra freezers, samples within these biobanks for research, okay? And the biosecurity workshop, okay, created a guideline of biobanks for biological materials that are aimed only to be used by researchers, okay? So we have how these samples are going to be collected, how they're going to be used, how they're going to be reused. And we also had a capacity building. We organized a webinar on biosecurity and biosafety that was organized by the UPCH jointly with Fiocruz. Okay. We have about 25 biobanks, okay? And they keep this in freezers. And we also have 3 biobanks that are highly acknowledged. One from the Tropical Medicine Institute, where we store samples of different diseases such as malaria, leishmaniasis, HIV. And so the Tropical Medicine Institute has many offices. And then we have samples for the biobank, and you can see the images on the slide. We also have the molecular epidemiology unit, okay, and also respiratory infections, TB research unit, okay. So we're trying to generate a biobank of samples that also comes from clinics, okay? So knowing all of this and the situation in Brazil and the situation in Peru and the Caetano University, we are doing this collaborative study, situation diagnostics of the biobanking culture in the scientific community in 3 Latin American institutes, okay? The main participants are the UPCH in Peru, the UCSUR in Peru, and Fiocruz in Brazil, okay? So that we can have a diagnostics of the culture of biobanks in their organizations. We have to have the objectives. We have to try to identify the knowledge of biobanks. What are the biobanks? How the samples should be stored? What are the practices, the attitudes, the needs that we need, okay, within the research community? So we show all of this challenging context in this study. The need for biobanks has been growing a lot, okay? Growing a lot. And so currently, the biobanks are essential structures for biomedical research. And so biobanks allow us to manage and to store biosamples in an organized manner, in a safe manner, and accessible to all. So its use is being analyzed to be used in genomic research, the study of chronic diseases, okay? However, in Latin America, we have a culture of biobanking in Latin America, so we have the need to strengthen our institutional capacity so that we can manage these biological samples in an ethical and efficient manner, okay? So the main objective of the study is to get to know the practices of how to best store biological and human materials and to understand the activities related to these biobanks, okay? Among these specific objectives, we have to identify the collection of biological material. We have to assess the theoretical, practical understanding of the biobanking or biobanks activities. We have to understand the interests and the needs, and we have to compare the differences between the institutions, okay? Okay, and what is the level of the researchers? Because the researchers are the ones who collect the samples, take them to the biobank. So they need to have precise concepts in this field of knowledge. This understanding not only of the principles, activities, and practices, we also have to understand, they also have to understand the informed consent that the individuals have to sign, how to do an ethical management of these biobanks, how to control the quality, what are the interests, what are the needs of the scientific community, and we need to strengthen the biobanks. We have to understand what are the barriers, what are the motivations, so that this can be implemented. And to wrap up, okay, we should compare the differences among all of the institutions, okay, regarding their institutional practices. It is a cross-cutting study that was created to gather information at the same time and also to strengthen the culture of biobanks. It can be used as a tool. We can use a self applicable red cap questionnaire, okay? And we have researchers and professionals from the 3 organizations that work or manage biobanks, okay? we have a study in the red cap, okay? And they include optional data. And so if the person would like to add their full name, or they can leave the form anonymous. We also collect some other general data. We also have a questionnaire. So the existence of the collection of samples, biobanks, number of samples, their origin, the projects, the services, the surveillance, and what is the most recent, what is the oldest collection of sample, the type, the quantities, the times they have been stored, okay? And so we have serum, tissues, what are the preservation methodologies, and the practices to share the samples. How often are they used?
The storage of biological material and the existence also of the institutional policy, because there is a directive of biobanks, the participation here is very important. So the previous capacity building in international standards like the ISO ones we have already mentioned, the institutional perceptions that are proposed, capacity building propositions. And of course, as all studies, there are ethical considerations. There is this informed consent. So then we ensure anonymity so that the participant can be okay. They can give their names without any issues, and benefits for the participants, sensibilization and capacity building. So there will be a feedback at the end. So it has to do with the better practice to share samples and data, and the ethical behavior has been approved by the 3 ethical committees in the Cayetano Heredia, Fiocruz, and UXUR, and the expected outcomes are the perceptions mapping, attitudes and knowledge about biobanks, barriers and opportunities to its implementation, key information about institutional culture, and how to improve our capacity building and our policies. And here also expected outcomes. So it has to do with this international cooperation. And the big strength is that it comes from an interinstitutional collaboration. So we are going to get to know also how it works, what are the attitudes and the practice of Fiocruz, and the regional relevance. This is the first project of this nature, and it has to do a potential to be replicated. And now here the challenges. So biobanks are still at the very beginning, so we have to reinforce the infrastructure at the international level, the security practices and the practice that we have here. For UXUR and UPCH, we invite all of you to take part in this study of institutional diagnosis of the biobanking culture and the scientific community of the 3 institutions. Thank you. Dr. Fernando, please. Good morning, everyone. So now I am going to present, to try and share my screen. Can you see my screen? Yes, now it's okay. All right. Okay, now it's all right. Okay, thank you very much for the presentation. So we're going to share the collaborative work that we have been carrying out with Fiocruz in the Peruvian University Cayetano Heredia in the Scientific University of the South. This is something that's very important to assess a little bit the basis of one of the main topics when one talks about biobanks, which are the bioethical aspects. So for the end, we proposed investigating the scientific production just in Latin American countries concerning the bioethic trends in biobank management. And here we have some preliminary results. We still don't have a full analysis, but I think it's good enough to be able to share the experience. We have seen the several findings that will illustrate the experience that we have had in publications concerning the topic that has been shared, and we've witnessed a remarkable increase in terms of investigation in bioethics and biobanks in Latin America and the Caribbean over the two last decades. We also have found a ascending trend in terms of scientific production in that field. And there is an important peak in 2020, of course, that it is related to it's pandemics related and all the efforts that were put into practice to make that happen. We have also found the trends in publication as a reflection of our countries and institutions. Some countries are at a different pace, but we are evolving in a crescendo. And in terms of biobanks, not only for biomedical research, but also the proposal of solutions for health-related topics. We have also found in results a significant impact on some citations, and in terms of bibliometric aspect, it gives visibility, and we still have to assess what are the practical results, but sometimes there are world facts so that ethics in biobanks can become a more visible topic. It can be more quoted than in other times, but it has to be assessed when we have a scientific paper that has been published. And other findings will show us peaks in terms of citation of articles, papers. It indicates a little bit of an echo out of the region, and it's significant in terms of scientific papers. Even more so when it comes to international cooperation. We see Brazil, Argentina, Chile, and Mexico, especially Brazil, has a very important international collaboration with universities and investigation research and research centers in the UK and the US, for example, and it is translated as citations. And then, of course, more Brazilian papers will be mentioned. Now, here, the methodology of this bibliometric research, I will sum it up here on this slide. So to start with, we have to filter what kind of studies we're going to type in here in our search. And we have included research papers that have been published and talk about biobanks, either animal-based or human-based. It is something that's very overarching. That was our goal. And the kinds of research designs or the kinds of documents that we have included in the bibliometric analysis have been original papers, systematic reviews with meta-analysis, and we have included governmental reports, documents of public policies that have some connection with biobanks, and we have included just the English, Spanish, and Portuguese, which are the languages that we can master as a group, and just papers up to 2000, year 2000. Also, not only talking about biobanks in general, but also bioethic or ethic aspects in the context of biobanks, and that are published with information from countries of South America and the Caribbean. So the data bank that we have consulted for this have been PubMed, Scopus, and Embase. So we considered some criteria, for example, papers that haven't been peer reviewed. So that's why we didn't include, for example, Scholar Google database, because not all documents there are peer reviewed. So opinion op-eds or theses, academic publications, sometimes we understand this as great literature, and it hasn't been included in this research. In addition, we have also found many studies about biobanking, but they didn't have any kind of focus on the ethics or bioethics that will not deal with these Latin American issues or reality, or that their studies haven't been carried out with Latin American populations. And here are some findings that we have had in the preliminary analysis. Will show us here. This is one of the findings. This is the search before filtering by Latin American countries. We see that there is a curve here that goes up, but from 2018, 2019 onwards, 2020 onwards, there was an accelerated peak, and it coincides with the pandemics by COVID-19, with a concern with the future analysis of biologic samples. And it became very important in addition to the topic of vaccine production, biobanks, and the ethic issues, the way that data is collected, the permissions, etc. They have had a very good relevance. Then after COVID, there was a small drop in 2023, but from 2024 onwards, the world production in the topic has been on an increase. So the world trend concerning this topic is close already to something like 400 papers comparing, for example, uh, just a few dozens 20 years ago. Now, concerning the current snapshot, we see that countries like the US, the UK, China, Australia, they take the lead in terms of scientific production, but in terms of Latin America, Brazil is the country that represents us as a region. So this collaborative work between two Peruvian universities and Fiocruz is very important in order to not only enhance scientific production, but also to start with implementations and policies. Now, this is a word cloud, which is always important when we do a bibliometric research, because in addition to the conceptual maps or the epistemic maps that we can draw with the search words or the searching items that we include in order to carry out this kind of bibliometric research, this word cloud here gives us a graphic overview into which topics are preferred by those who are interested in the topic. So the bioethic aspects of biobanks. We see here, for example, that words such as that will reflect studies on humans with differences, for example, between male and female, terms as informed consent, terms as biological specimen banks, and some age groups, some research designs. They will give us an idea here of the productions here that we have. Now we see here the Latin American and Caribbean scientific production. We see that the curve is a little bit more chaotic, but given the I'm going to see here as a region, see if we take a look at the previous slide, it's more or less similar from 2010. We had a peak as in terms of scientific production, and it kept stable until 2018, 2019. So in 2020, so given the COVID-19 pandemic, we had an increase in scientific production. So this is a very similar curve, but with more ups and downs given the fewer number of papers. If you remember the previous slide, we're talking about hundreds of papers, and we have achieved 400 papers that have been published. But now as a region here, we are more or less getting to 20 or 30 papers. So Latin America and the Caribbean, they don't get to 10%. They don't represent 10% of the world production, which is very low if we compare with other topics. And we must remember that they are not papers about biobanks in general, rather bioethic aspects in terms of biobanks. So these are the most relevant affiliations, those who produce the most concerning biobanks and bioethics in Latin America. We see that ranked third and fourth, the University of São Paulo, which would be one of the Latin American affiliations, and then we see universities from the US and the UK ranked among the top places. And if you see, regionally speaking, we are represented mostly by Brazil, and at the world level, the US and the UK. So cooperation is good, but in the future, it would be interesting to see here other universities or institutions from Latin America also taking the lead, right? Now, concerning the co-responsible authors in red, we see here the corresponding authors countries. From here, well, just one person, and in green, multiple authors. So for example, here, Latin American countries with more presence in papers with a corresponding author: Brazil, Chile, Mexico, Colombia, Argentina, Ecuador, Costa Rica, and Guatemala. So Peru, for example, is still lagging behind, but we believe that with this kind of collaboration such as this one, things can change. Now I'm about to finish this slide. I believe it's one of the most interesting because it talks about the trend topics. So the topic that will deal with the scientific papers the most. So here on with the base on the left, around 28 to 2010, topics were more basic, so to say. So there were lots of topics, bioethic topics, and biobanks. And the topic was more related to informed consent, environmental exposure, international organizations, not searches that will give us an idea that, well, maybe lots of research centers were establishing the basis for biobanks. Now, if we take a look at 2013, 2016, topics have changed into countries, specific countries such as Brazil, scientific investigation, quality control, and then we start to see some specific diseases. And here we see some specific topics like diabetes mellitus or blood pressure, human tissues. And we have some research designs here already, specifically those that are cross-cutting. But if we see 2019 onwards, we already see terms that talk about follow-up, that talk about follow-up longitudinal studies. They talk about other countries such as Chile, for example, or regions such as South and Central America, and it reflects more international collaboration. But the most important thing here is the presence of more specific diseases. There are more researchers that will focus on that. For example, asthma and other diseases, and the presence of cohort studies. So we can see that the topic has been ripened throughout the course of time. So it has to do with the preliminary analysis. So it will be very interesting to be able to change that. But we see a trend that will go over with the topic. So there is a trend of growth in the region. And that's why this has been done, this bibliometric analysis. So then we can have an idea of how we were 25 years ago, where we stand now, so that we can have a solid base. Now, key messages. International alliances are very important. We have to learn and to. So we have here, for example, the collaboration Brazil-US is the more productive, but there has been an increase of the collaboration in the South-South countries. So, for example, Chile and Brazil are the ones that could be working more, but it will be ripened according to the collaborations that will be there. There is an excellent growth potential in the region, and we have detected aspects that have already been there 20 years ago. For example, follow-up studies and specific diseases centered on specific disease. So it gives us an idea of specialization with a criteria of ripening the topic. So that's it. Thank you very
That is
much.
everything. Thank you so much for your attention. We thank you very much. We thank all of the speakers very much. Sorry, your audio is too low, sir. Thank you very much to the speakers for their outstanding presentations. Let's continue with a round of Q&A, okay? I believe we have a question from Regina Codas. So, how do you control the responsible storage of the remaining of the researchers in the private labs or in the biological industry? How do you control that, please? Currently in Peru, we don't have a national rule or regulation for that, okay? So we have big initiatives. Each institution is generating their own guidelines and rules and regulations. And so we schedule audits, okay, throughout time. We have a biosecurity official who is responsible for doing these audits. And so each institution has their own rules, regulations, and guidelines. But at the moment, this is not regulated. Thank you, doctor, for your answer. I believe we have another question from Jeanette Malka. How is the biobank culture in Peru being reflected in 2025? So the study that we're doing is exactly to find out what is the biobanking culture in Peru, at least in the two main universities that we have here that are part of the study. They are two major universities. So based on this study, or when we conclude it, we're going to be able to find out what are the practices, who is responsible for the biobanks. However, at this moment, we don't know it. We don't know it yet. Thank you very much. Let's continue with, I believe we don't have any other questions. Let me check. Okay, good. If there are no other questions and remarks, let's continue with this morning's second block of presentations. Daiane, please, can you continue? Could you please continue, please? Just a minute, please, because I haven't been able to switch on my camera. Just a second, please. Oh, I got it. Okay, thank you. I'm gonna share my slides with all of you. Just give me a few seconds, please. Can you guys see my slides? Can you see my slides? Yes, Daiane, we can see your slides. Thank you very much. Good morning, ladies and gentlemen. Well, actually, good afternoon to all of you. It's a great pleasure to be a part of this biobank on infrastructure, responsible storage. My name is Daiane Sertório, and today I'm going to share with you part of how the best practice documents and regulatory documents can facilitate this process of implementation of biobanks and a little bit of our experience from the Fiocruz network. I am going to base my presentation on four main pillars: human resources, equipment, software, infrastructure. So this is the Fiocruz Biobank network, okay? We have five accredited biobanks in orange here, one in Rio de Janeiro, one in Minas Gerais, one in Bahia, and now we're working to expand our banks, and we would like to include five new biobanks that are still being developed. And so we have these biobanks in Biomanguinhos, in the Oswaldo Cruz Institute, in Fiocruz, in the biobank Biodiversity and Health that was mentioned by Dr. Ernesto, and also in Fiocruz, Bahia, Fiocruz, Minas Gerais, and Bahia. And the ones that are under development are in the Fernandes Figueira Institute, Fiocruz, Pernambuco, in the Ageu Magalhães Institute in Paraná, in Ceará, and also in the Leônidas Maria de Annes, in the Amazonas Fiocruz, Amazon Fiocruz. For the establishment of the physical infrastructure, the foundation for a safe and efficient biobank resides in its infrastructure, and it's important to design these spaces specifically for this purpose, with controlled climate or temperatures, with robust security measures, okay, so that we can protect the biological samples. So if there are future expansions, we have to be ready for that. But we know that not always it's possible to have a new building, a new infrastructure to implement a new biobank. And even so, it's important that when you are adjusting the existing infrastructure, you have to separate areas for each one of these processes. Besides that, it's important for us to implement environmental control. We have to control the temperature, the humidity, the negative or the positive pressure, and the air filtration, and also integral security and safety. We're not only keeping one element safe. So biometric access control, how are you controlling the people who are coming in and going out of the biobank? Is there a registration of the people that are entering? Do you have 24/7 monitoring? And so you have to protect the physical areas and the data as well. And so we have storage of samples, we have storage of data, and we also need a fire extinguishing systems or fire systems trying to prevent this kind of accident that a fire may start. Regarding the equipment for the biobanks, okay, thinking about infrastructure and equipment, the equipment to process the samples or the biological materials, they are essential to ensure the quality of this biological material. And the most adequate, okay, so we need to ensure the right equipment, the adequate equipment. So selecting the adequate technologies is essential to preserve the integrity of all of the samples. So it's important for each biobank to have in mind, what is my purpose? And this is going to define exactly which equipment they are going to need. But this is basic for the processing of biological samples. So we have refrigerated centrifuges to separate cellular components, mainly when we're talking about blood, pipettes to separate these biological materials, okay? So when the biobank has a high volume of processing, if possible, they should have automated pipettes, okay? Automated pipettes. This can increase the accuracy and the replicability of these processes. We need biosafety and biosecurity cabins, okay, or booths, pardon me, booths, okay, to protect the samples and the operators. We need barcode readers to ensure the traceability of this biological material. And for sure, computers to make sure that all of this information is recorded, registered, and as often as possible electronically. Now, the storage. The storage of biological materials usually happens at low temperatures, extra low temperatures, and to ensure that these samples are gonna to continue being viable in the long run. This is not the only storage way. We also have storage in refrigerators between 2 and 10 degrees, and we also can store certain samples at room temperature. We have new technologies for storing DNA, but the standard for biobanks is storage at ultra low temperatures. And so in the Fiocruz network, we use equipment to maintain these ultra low temperatures, such as liquid nitrogen tanks, ultra low freezers. And when purchasing these pieces of equipment, it's important to consider how are these equipments? Are they efficient? Are they energy efficient? Because biobanks, they have a carbon footprint. They have a considerable carbon footprint, a considerable impact on the environment, and also for the storing, it's extremely important to consider backup systems for each piece of equipment. Do I need a backup? No, not necessarily. But depending on the number of pieces of equipment that you have to assess the need. Do I need to establish a backup system? So for each 3 or 4 pieces of equipment, leave one on standby if one of these pieces of equipment stops working, or even to buy pieces of equipment that they themselves, they already do their backups. They are their backup system. So they themselves, they can provide the backup system. We also have backup systems with liquid nitrogen, with CO2. So there are many, many backup systems. We also have to consider a backup for the electricity, because this equipment uses a lot of electricity. So if you have a blackout, what are you going to use? Do you have generators? Do you have an electricity backup system? Are these generators going to be enough to keep these pieces of equipment functioning? If you don't have any more liquid nitrogen, how long are they going to keep the samples viable and safe? And so you should consider implementing a backup system as well. And every time we talk about backup systems, we're talking about redundancy. In the field of biobanking, redundancy is a key word, because the samples are stored, and frequently they are extremely important, and many, many times it's not possible to substitute them. So you need continuous monitoring. Anytime there is a change, they're going to issue warnings, send messages, so that the professionals can take the necessary measures and avoid the loss of these biological materials. Okay, when it comes to the biobank management pieces of software. And so we have LIMS and BIMS. They are biobanks management software, and they were created specifically for the management of biobanks. And it's important to consider that a management software is the brains of the biobank. They maintain the records, the inventory, the stock, and we have the records of all of the processes, okay? And via these pieces of software, we can have data integration, complete traceability, management of the inventory, security of the data. They can also transfer data so that people can carry out the research. And we have to ensure that these systems are safe, secure, that we're going to ensure the confidentiality and privacy of these data, that the profiles found on these systems, they ensure the confidentiality, the security of these data. These systems must be safe and secure. We need to work with data encryption, because if there is a breach, okay, or a hack, that all of these data are protected. We also need a backup system for all of this information, mainly at this moment in which we find ourselves, that data are extremely important. And when we talk about biobanks, we can already see this, mainly in Europe. They are using the data, they are datafying the banks. And so the most important is receiving the biological materials, process this material, and generate as much information as possible. So it's important never to forget the security and the safety of these data. And then still along these lines, okay, we have the quality control, okay, and compliance with all of the rules and regulations. When you implement a quality control system in a biobank, it is extremely important to ensure that all of the biobank processes are going to work well. It's important to say that quality is not a state, it's a continuous process. And the quality control management for biobanks that is efficient, it's important for it to comply with the rules set forth by ISO 20387. It's an international biobank standard. It follows the ISO 9001. Oh, does a biobank need all of the ISOs? No. If they follow the 20,387, it's already complying with the other basic ISOs, quality ISOs. And this is important for it to be acknowledged. And the biobank must be accredited or certified, but there is no accreditation for biobanks. And mainly at the beginning, we talked about the establishment of a biobank. A biobank has to analyze these rules and regulations, study the best practices documents, and use that as a basis for their implementation so that all of the processes since the very beginning, they have as a premise or as a requirement quality standards, quality of the samples. So it includes internal audits that happen frequently, also POE documentation, calibration control of all of the equipment, and the constant capacity building of their staff and personnel. So these are important elements that should be considered so that we can think about a quality control system. And since we have mentioned the staff, the human resources for a biobank, they are the foundation. A highly qualified team, they're going to represent the success of a biobank, okay? Have invest experience, commitment. This is going to ensure the quality of the data in the sample. So when we talk about key profiles for a biobank, we need to have a curator for the biological control. He's going to be responsible for the management of all of the steps. He's going to be responsible for the quality control. We also have the profile of the lab technicians that are going to process and store the samples. We also have managers, data managers, and bioinformation managers that are going to manage the limbs and the BIMs, and they are going to be responsible for the traceability and security of all of this information. And these data must be stored and transferred and analyzed whenever necessary in an adequate manner.
Then we talk about capacity building of such profiles. The profile that is required for action in biobanks. So you must have a graduation in biomedical sciences, experience in the lab, and it's important to have experience or develop experience in team management, people management, and the data manager. It's also important with bioinformatics. It's key to problem solving. It's important to be attention, to have a detail oriented, and it's important to have all these qualities because they are key elements to really have a good team managing a biobank. And also to keep that up, it's important to have continuous capacity building in the different roles that should be updated whenever needed, just to ensure that the best methodologies are the ones put into practice. And talking about management, risk management, we should mitigate risks. It's extremely important to ensure the quality and the continuity of the biobank's operations. In that regard, we have here, for example, what we have already talked about, the power outbreak or any kind of downbreak in terms of team, in terms of equipment, in terms of natural disasters or security violations. So these are key elements so that the biobank, since its inception, can have this risk assessment carried out. So here I talk about a better practice from ISBER. So all this material has been prepared based on the good practices. So I have a very specific one here where it's important that biobanks can identify and assess risks according to their activities. So a risks mapping, it's not something to be done standardized. It is according to each biobank, it can be very different. And here to close it up, as per the final recs, Cynthia has already mentioned a little bit the ethics and the normative aspects. It's extremely important that the biobank, even more so if there are specific norms, that the biobank should follow them, and if there are not, the international guidelines should be complied with in order to ensure that the bioethical aspects are followed and met. So with a minimum and even a safe infrastructure, it will ensure the robustness of the operation. No need of cutting edge equipment, because we know that lots of biobanks will start off as something more simple, but it's important to ensure that it is insured so that in the future they can have such cutting edge equipment. But what's more important here is a team and operational procedures that are leading edge, and also functional and adaptable software. So softwares that won't catch up with a development of a biobank. It's an issue for the development of data and samples, and a good quality team in order to ensure collaboration between the biobank and the other institutions and all the internal processes. So this is my message here, so that we can implement good biobanks in the Latin American institutions. Thank you very much. This is the email of Fiocruz Biobanks, and we are at your disposal. Many thanks. I will continue with this round of presentations, and now I am responsible for this topic, foundations and good practice in the biobanks management. This presentation is focused in terms of biosecurity and bioprotection. Biobanks deal with biological samples that can represent risks. We can storage materials in biobanks that are animal-based or human-based, or even blood, tissues, DNA, RNA, and pathogenic materials as well. As such materials, depending on their origin and conservation, they can represent risks from the biological point of view, either personal, that will manipulate as in the environments where the installations are. The biological risk, the most evident one that comes from the samples that are infectious samples. They can have viruses, bacteria, parasites, so that they can even trigger diseases in those that manipulate to deal with such materials. Even for the others, it can represent a risk, for example. That's why it's important to handle such materials safely. So spilling or something else could have consequences. So it's important that the biobanks have a constant risk assessment. So to the end, we have tools that we can use. For example, the WHO risk assessment, and other international organizations have theirs as well. We also have to classify risks in terms of what we're going to store. For example, we can roll out standardized protocols, for example, with a specific storage in the case of transportation as well, and it will generate residues, how to handle them and dispose of them. That's why it's also important to involve staff and give them capacity building in terms of continuous capacity building to complement such international standards. Biosecurity and bioprotection are a pillar, a critical pillar, and we have to take them into account in order to protect staff, the team, the environment, the security, the public
health security and in the context of biobanks, it will allow us also to implement these measures of biosecurity and bioprotection and ensure traceability to control access to the installations, to the facilities, to ensure good management of the data that is generated and to prepare ourselves to increase our preparedness to incidents. If we don't take into account such pillars, for example, bioprotection, biosecurity, such biobanks wouldn't be apt to integrate public health systems, and all the concepts should be object of a framework of public policies. And a bit here to remember what biosecurity is for those who may not know yet. So biosafety has to do with the principles, techniques, and practices to contain that will implement in order to avoid non-intentional exposure to biological agents and toxins or their accidental release. This is to protect the human health, the immediate environment where the facility is located, concerning the risks that will be generated when you handle such materials. Now, in simpler words, we take care of ourselves and protect ourselves against the biologic materials. And another topic here that we were mentioning, bioprotection, that is also known as biocustody. It is complementary to biosecurity, and it has to do with preventing the loss, the stealing, in this case, intentionally, of biological material, something that has to do with, has dual potential. They can be beneficial as well as prejudicial to human health and the immediate environment. So what is biosecurity in terms of biobanks? In terms of biosecurity framework, it is very important because it it stores biologic material that are dangerous, hazardous. So we have to ensure protection against exposure. So physical barriers and administrative procedures will decrease risks, and other people that will be exposed accidentally. So it has to do with this safe work, the correct use of samples, and the protocols for manipulating, handling such materials. Something else that's very important here is the protection of the staff, the personnel, the community, and the environment. So the focus of biosecurity in biobanks, not only will it protect those that are directly engaged in handling such materials, biologic materials, but also the immediate environment and community. Now, what are the essential components? The standardized operational procedures. They are guidelines that will make it very clear how to deal with the biological material. Now, concerning the teams, as the previous speaker has already mentioned, there are cryopreservation systems, and we are going to mention that a little bit further down the road, and it has to do with giving protection to the staff. So the secondary protection systems and concerning the design of the biobanks has to do with the facility. WHO has already rolled out the classification of labs in terms of biosecurity, but there are other international organizations such as CDC, where they classified that in terms of biosecurity 1, 2, 3, and 4. And the restricted access to such areas. So in case there is a mistake in temperature or something like that. So this is in a culture of biosecurity, right? And it has to do with the continuous capacity building of all the personnel here. Now we're going to go to the next question. What is bioprotection in biobanks? We had already defined what bioprotection is, policies and procedures. So we put that into practice to avoid the improper handling of biological materials in such environments. And they also have to do not only with biological material, but also the competence of the personnel, the structure, and the facility that where such materials are stored. So it is focused not only in terms of protection of the material, but also the protection of the information that is going to be generated that is linked to that, and it has to do with the access control to such resources. As we'll see, the bioprotection or biocustody is a fundamental component to have an integral focus on that. Now, the risks assessment, I was mentioning that WHO in a monography that was published in 2020 sets out guidelines as to how to carry out such risk assessment. In terms of biosecurity and bioprotection, it's a series of 5 steps to be taken. So we can carry out a risk assessment by evaluating the agents that are potentially hazardous, for example, samples of biologic materials that we are storing. They can be microorganisms, pathogens, they can be toxins, they can be also human material like tissue, blood, and among others. The identification is based on the nature of the biological material, where it comes from, clinic, material, animal origin, and the information that is also important is the pathogenicity, the transmission chain, the etiology of the disease. Everything will help us identify here the hazardous agents. Also, we can carry out this classification of such materials according to the risk assessment, something that can cause diseases, the transmissibility, impact on public health, or the existence of prophylactic measures. And it will make us remember when WHO classified biological hazard from 1 to 4, CDC that classifies labs in terms of biosecurity level, and other international norms, for example, or even national in Peru, biosecurity and biocustody, where we also mentioned this kind of activity related to the handling of biological materials. Now, concerning the assessment of tasks and critical procedures, we analyze the risk associated not only to what has to do with the biological agent, but also the way that it is going to be done. So if it's a culture or sampling processing, if it's going to be kept or disposed of, direct exposure, or, for example, ingestion, inhalation, things that can happen for the projects that can vortex and other devices. And as I was mentioning as well, the competence of the personnel engaged. So the combination of such characteristics classify the biological agents in groups of risks, the control measures, and the need of formation will allow us, the combination of such factors will allow us to determine this. Now, concerning the design, the biobank facility areas should be of such biobanks should ensure samples, the integrity of the personnel, and also the immediate environment. And it had to reply or answer, meet some criteria, standards of biosecurity and bioprotection. One of them, for example, is the unidirectional flow of the samples. A working flow should follow this, something that's logic secure. The material is pre-selected up to its storage. So this principle will reduce or minimize the possibility of a cross-contamination or something that is accidental. So in this case, we also recommend implementing, for example, clear signage or routes that are something specific for handling tissues or biologic material, and it has to do also with the traffic of people, of the staff. Something else that is very important are the areas that should be separated here and controlled. So there should be functional zones that should be marked in each process. For example, if there was a sampling area here or the storage area, we can see, for example, the freezers and liquid nitrogen tanks and the shipping of samples somewhere else. Everything should be physically separated here and with different controlled access levels, and it should be very readily identified. Something else that is very important here in terms of designing an infrastructure is that what for the continuity of the biobank. So for example, this will be kept adequately and the samples as well. So we can see, for example, the alarm systems in case of temperature failure, for example, in the ultra freezers or the liquid nitrogen leaks in the case that, for example, light went out or something that depends on power generators. So a remote and automated monitoring of temperature, pressure will be interesting. Other considerations that we should take into account has to do with investigation. Materials should be there and should be resistant to chemicals.
Control of the access. Okay, so we need surveillance cameras to do everything to check everybody who goes in and out. Another important point are the personal protection equipment. So in any kind of labs, this is essential. Why? Because it's going to protect us. You're going to get a sample, process it, transport it, and they are biological samples. Okay, so they offer a certain level of risk. Correct selection of personal protection equipment is very, very important to see what kind of personal protection equipment you need, okay? And so we have to use it appropriately, okay? And obviously, at a certain moment, we're going to have to throw them out. So we need to be able to discard all of these personal protection equipments adequately, okay? And so this is the use of this equipment, protection equipment is mandatory, okay? We have gloves, they can be disposable. We have special gloves that were designed so that you can handle extremely cold materials. You have the protection. It can be, you can use it several times, and also the all this blue thing that you can use on top of your clothes to protect you, okay? All the adequate equipment. Regarding the storage, okay? So the safe and secure storage is essential when it comes to biobanks, because by doing this, we're going to be able to preserve all the samples that we are storing. And this process requires a special equipment, okay? As you can see on the slide, we need freezers, refrigerators, ultra cold refrigerators. We need liquid nitrogen, okay? And so the freezers that we are going to store input and biological samples that need to be stored at -20 degrees. For example, the ultra freezers we're going to use to store samples in the long term, okay, in the long run. And so these pieces of equipment, they offer stable conditions. They allow us to store the samples adequately. And finally, we have liquid nitrogen tanks, okay? And so this is used for the cryopreservation, okay? Cellular materials. And it can be liquid or vapor, depending on the type that you buy. When it comes to the continuous monitoring of the temperature, this has to be recorded. 24 hours a day, 7 days a week. We need alarms that can be sound alarms or visual alarms. The systems that are connected to the platform, when it comes to the management, okay, they need to be, we need to see what are the conditions of the storage. We had already mentioned about the electrical systems, okay? We need the redundancy of the equipment, okay? And we should try to avoid the losses of the loss of these materials that are so important. We need contingency plans. We're going to discuss them later on today. And so if there is a mechanical failure, if there is a blackout, if there is no more electricity, so it's important to frequently offer capacity building, to have some simulations. What are you going to do in case of leaks? What are you going to do in other situations? Regarding the organization's best practices, it's necessary for us to have the samples, all of them organized. How are they stored? How are they being stored? And we need to have access to the internal part of the pieces of equipment to see and to test the temperature. Regarding the restricted access and security, so the storage areas, they must have controlled access, okay? And so you should implement physical security measures. We need to have locks. We need to have cameras, surveillance cameras, and digital systems. And continuous surveillance, supervision, monitoring, okay? Another topic that is extremely important is traceability. Traceability is an important element to ensure the integrity of the samples we are going to store. So you're going to trace each and every sample from the moment that they are collected up until their final destination. And we have to ensure each step, and everything has to be recorded, registered, verify everything. You have to have barcodes, QR codes, and everything has to be registered, okay? And we have to ensure the confidentiality of the patient, and this identification is key to avoid confusions and loss of information. Okay, a registration and recording of all of the movement and accesses. You have to register everything, the collection, the transportation, the storage, the analysis, the discarding, the final discarding. And in these records, you have to write down the date, the time, the person in charge of the analysis of that sample, okay, everything, all kinds of information. When it comes to emergency plans, it's important to have management of the biological materials. We need to also know what to do in cases of emergencies, so that the staff that are working there, they're not going to be at risk or in danger. And we need to know how the biobank is going to work. So you must have protocols to avoid leaks, to avoid electrical failures, to avoid the loss of temperature, okay? If there is an accident, we need to record everything, to record all of the accidents or incidents, the registration, then analyze them. And so we have to analyze each accident, okay? They need to undergo an analysis so that you can carry out corrective measures, okay? And who was the person in charge of that? We need to have simulations periodically, okay, of these situations. So if they happen, if the events happen, you're going to be ready and prepared to do whatever is necessary. And these emergency plans have to be integrated into the institutional coordination. You need a support network. All of the corrective measures have to be documented. Okay, training courses for your staff. This is also extremely important because then you're going to have a safe operation to avoid risks. So they need to be well trained, and then we're going to be able to avoid incidents, accidents, and, and they are going to be able to handle the samples correctly, and you're going to be able to create an institutional culture of safety and security. The training courses have to include biosecurity and bioprotection. It should include as well practical exercises, emergency responses, okay? You need to have a continuous reinforcement, strengthening, and evaluation of all the best practices. You need to have continuous improvement regarding the documentation and the registration. Every single training course and capacity building has to be documented. Which content was taught, who taught it, at what time, when, and so that we can have traceability of the capacity building as well. And what is the target audience? Okay, and the researchers, the lab technicians, the admin personnel, the maintenance personnel, because at a certain moment they can cause damage to a certain piece of equipment. Okay, so you have to create these capacity building courses thinking about the target audience. And now to conclude, we have the biosecurity and bioprotection are essential in all biobanks, of course, because you have to ensure the integrity of the samples. And this is going to allow us to protect ourselves, okay? Because we're going to be involved directly in the processing of the samples, protection for the community that is surrounding us, and wherever these biobanks can be found. And the implementation of the infrastructure, to improve the infrastructure, to implement standardized processes, to have a biosecurity standard, biosecurity standards part as being part of the culture. Okay, this is the responsibility of the institutions. And so the sustainability of a biobank is going to depend not only on the technical capacity, but a commitment with a constant improvement of biosecurity and bioprotection. Prevention and control are under the responsibility of the institution. Thank you very much. Now, I would like to pass the floor to the next speaker, please. Good morning, ladies and gentlemen. Can you hear me well? Can you hear me well? Yes, ma'am, we can. So, can you see my slides? You just need to put them on presentation mode, ma'am. Thank you. Now, can you see the slides? And now, can you see my slides? Yes, now we can see your slides. Thank you. So I'm going to start. I have 20 minutes for my presentation. but maybe I'll be able to wrap up within 15 minutes, okay? My name is Cristiane Campero Bressani. I'm a clinical researcher. I work at the virology lab at Fiocruz and the west region of Brazil, the west part of Brazil. I'm also member of the management committee of the biobank network that belongs to Fiocruz, and I'm also a regional co-researcher in the Global Health Network. And today I'm going to talk to you about the use of the REDCap research electronic data capture and how it's being useful to all of us, okay? To start off, I would like all of you, please, to answer this quiz, please, REDCap quiz. We have a few questions about the REDCap. Please use the QR code here to answer these questions, please. I'm going to give you 1 minute so that you can answer the questions, please. So that you can answer the questions, please. Okay, I believe everybody is ready. Let's continue. I would like to talk to you and I would like to share with you that REDCap is an important tool for the collection of clinical data. It was first developed to do that, exactly that, at the Vanderbilt University in 2004. And after that, it was developed and used all over the world, and now it's present in many, many countries. And the tool can be used by a university, and also it can be used for many, many purposes, including experimental research and management research. This platform is totally free if you would like to purchase it and to update it. Even though it's not open, it's not open source software. It is a safe, secure platform that complies with all of the rules and regulations when it comes to clinical researches. And it's only made available to organizations that are nonprofit organizations. So any nonprofit organization can request the license and use it. And in order to do that, you need to have a minimum infrastructure, an IT infrastructure, and with an IT expert so that he can become the manager of the platform within that organization. But your institution cannot aim at generating profit. In Brazil, it was introduced in 2011, and just like the one, It was introduced by the Medicine College at the University of São Paulo. And it's a highly intuitive platform for the simplified creation of instruments, so that, as I mentioned earlier, for the safe management and collection of data. And everything can be done online, okay? And it has tools that adapt to almost any research design, okay? So such as clinical researches or experimental researches, okay? Any kind. And so I'm sharing this slide with you so that you can get to know the publication on the red cap. Okay, so red cap was created at the Vanderbilt University by these two main researchers, Paul Harris and Robert Taylor, in 2004. And they only published their findings in 2009, showing that 286 research projects, okay, were already using REDCap, okay, for the collection and management of data. And REDCap was already could be found in 27 institutes all over the world, okay? And so now on this slide, you can see the link to the REDCap's website, okay? To the REDCap's website. And this is the original platform because there are also REDCap initiatives in other countries in which they offer courses, resources in different languages, in local languages. But this is the original platform of the REDCap project, okay? And here you're going to be able to find lots and lots of resources so that you can get to know this tool better, yes? And you can also register temporarily, okay? And it's free to do that, individual registration, so that you can test the REDCap platform for a few days.
This is a very interesting resource that one can have access to through these QR codes, where we can observe each institution that has a registration, or even more. Some institutions have more than one registration, like Fiocruz, for example, has more than one registration in different units, or different units. So this map is interactive. You can zoom in and see even the name of the institution where the REDCap license is. And if you press on the red dot, you will be able to see the name of the professional of computer science that is responsible for the license, the registration in that institution. Here I zoomed in Peru, and here we see an account in the Liga contra el Cáncer. This is the Alliance Against Cancer, close to Trujillo, in the north of the country. And in Lima, we have an account, a registration for each of the institutions. And one of them is the Peruvian University Cayetano Heredia, UPCH, and the other two ones here that I am not aware of, but maybe you've already aware of. And here, if you hover over the pin, the location pin, you will see the name of the institution and the person in charge. All right, now, why REDCap is so useful and important? because even before this paper that I bring up today here, RedCap worked with the idea of collecting data, scientific data, mainly clinic data, structured and safe clinic data that are collected, and they do so following the international guidelines for clinic investigation. And today we see that RedCap is aligned, RedCap is aligned with the FAIR guiding principles for scientific data management and stewardship. They were published in 2016 by Wilkinson and collaborators. And it showed already a movement so that the scientific data are considered more and more. So here we propose 4 important characteristics that we should look for our research data. So here the characteristics are these 4 there's 4 letters here. So F is findable, for example, something that you can locate. Yes, so the data should be able to be located at any instance. So the A in FAIR has to do with being accessible. So data should be accessible. As well as the fact that data should be interoperable. And sorry, I hadn't changed the slides here. Data should be interoperable. So it is also important to say that both the data and metadata, so for example, data that complement the initial data, they should have the 4 principles here. Interoperable, it means that data should allow different tools for their processing, and also reusable. And reusability is very interesting. So there is a big focus here in the last years, and it is very well aligned with the biobank principles as well. So if we collect and manage our data, our investigation data with this tool, with such characteristics, we will be aligned with these principles. And here I am going to show some examples of how we have used RedCap and how RedCap is being useful to our works in the Fiocruz network of biobanks. So first, for the planification of the network, this is an example of a survey. So a survey that was carried out by the network so that the curators of the biobanks, the current or the future biobanks, so that they could reply to that concerning the equipment for the biobank in the network. So the researchers have put into practice here the equipment they were in need of. Here an example of how we can use RedCap for the management of the samples. So this is the screen as it shows for RedCap. So here we have the ones here to the left of the screen. We have different surveys, one for the registration of researchers, the other for studies, projects. Here, the participant of biobank as well, for example, or the ones that are donating, as we call them here. And here to register as well the samples. So the number of samples, their volume, the kind of packaging. Now, RedCap is very important, as I have already mentioned, to collect data that are associated to the samples, sample associated data. As Diane has already mentioned, biobanks are not only structures to store biological samples, but also of the data associated to the samples, because a sample without data doesn't work for research, doesn't serve the purposes of research. So here, for example, we have data on the pre-processing of the samples before placing them in the biobank. Well, here, for example, some information of the donor, like the name, birth date, skin color or ethnicity, and gender, as well as the surveys. Surveys can be applied or rolled out to any kind of data they would like to collect. In addition, RedCap is also used to develop our projects, our research projects concerning the biobank activities, concerning biobanking. And as Cynthia has already presented, and Fernando, we have two projects according to which we're going to use RedCap for the instruments, to develop the instruments, the research instruments, and to collect the data that we want to. The first project of the three institutions, engaged to do with the very important support of the Global Health Network, which was the institution that facilitated this connection. We have already developed an instrument, it's already there. With the digital informed consent as well. This is a very interesting tool that RedCap has in its toolkit. And here the title of the project is Situational Diagnosis of the Biobank Culture in the Scientific Community of Three Institutions in Latin America. So we're going to apply this, the researchers, as well as the technicians in all the Fiocruz units in Brazil. We're going to have this applied in all of our regions in the country. And we are going to have very interesting data. And here I will add data from the service. The two Peruvian institutes will apply them here. So this is here for you to get to know how it is presented, how a survey is presented here in red cap. Oh, it is very beautiful. I think it's very beautiful and very easy to understand, very easy to reply to, and it's very intuitive, both to build the survey and to respond it, to fill it in. This is the survey that we're going to apply to the researchers. So here, for example, we have, as Cynthia has mentioned, some information that are optional, that are personal information from the researchers, like name, birth date, institutional email. And here are some variables that we would like to collect about biologic materials, human biologic materials, about the practice of the researcher. And the other study that Cynthia didn't mention, Fernando didn't either, it's the study about the assessment of attitudes and knowledge on biobanks. So in this case, we applied the survey banks for in the population. It means people that are potential participants of biobanks. The original project came from a Fernando team. They proposed this study in addition to another study that has already been presented. And we have already translated this in Brazil into Portuguese, this project. And in the next months, we're going to submit it to the ethics committee. This survey is something that was already published in English in 2014. This is the paper. You can take a look at it, and there is a version in Spanish that has already been validated to Spanish, and I am going to share that with you as well. I'm going to share the link. Okay, my time is up. Thank you very much. Thank you very much, everyone. It's been incredible, this moment to share with you all of these, and I am very happy and learning a lot. So here are the three links, QR codes, the references. The first one is the red cap in the world map. The second is a reference to the FAIR papers, and the third is the reference of the bank's survey in Spanish, right? Thank you very much. We thank the speakers for their excellent presentations. Now we go to the next Q&A round. Cici Nunes says, if we just have freezers at -20, how long would that be able to keep the biologic material? You're asking me or Henry? Are you directing that or? Well, it depends on what kind of sample and the proposal of use of the sample. So this is difficult with just that info to talk about the time of storage and the usage. So it gotta be the purpose. Thank you very much, Diane. So the next question, Bunny Cordoba. So the BioCruz bank as the ISO 2837 or any other ISO? Thank you for the question. The BioCruz biobanks aren't accredited or ISO certified yet. ISO 20387 doesn't have an accreditation process in Brazil yet. In Metro, which is our Institute of Standardization in Brazil, is finalizing this accreditation process with a pilot underway, but we don't have such accreditation in Brazil yet. As soon as we have it, this is something that we're going to look for. Okay, thank you very much, Teolis Bessa. So basically, the question is if there are accredited biobanks in Brazil and what would be the prerequisites and how it is done. In such a way, it has to do with the previous question. We don't have this process defined yet, but as per the criteria has to do with the ISO 20387 has all the criteria for the biobank. They are necessary for that the criteria, all the ones that are defined. So accreditation can be partial and it may not include all the criteria in the norm. So each biobank will define which elements of the norm will be accredited. So according to that, the institution where you work has to have access to it, ISO 20387, to define in which processes of the norm will be accredited. It doesn't exist in Brazil yet, this accreditation.
Muito obrigada. Agora nós temos uma pergunta de Peru em relação aos biobancos. We are assessing this now. And we are discussing the biobanks information, okay? We're trying to decide if this is going to be done now. I would like to complement. In Brazil, in Fiocruz, we are planning a post-grad course on curatorship, okay? And also the management of samples. Maybe we're gonna be able to have institutional partnerships for that matter. Perfect, very much. Now in the next question. Thank you very much for your presentation. When it comes to the management of software, is there a specific management of software? So afterwards, you can send me an email, and we have already assessed a few of them when we were acquiring the system that we decided to use. So we need to assess software that work with diverse or several biobanks. We work within a network, so the software must encompass this element. So there are only a few in the market that do that. But for a single biobank, there are many pieces of software, and we can share this with you. And I can even discuss this with you guys, and I can add it to the chat. RFBB, the Fiocruz network biobanks, okay? So we have the link for you guys. She says, congratulations for the wonderful presentations. My question is, which pathway did you start using to use the governmental policies to implement biobanks? That's a highly complex question. In Brazil, we have rules and regulations for biobanks, general rules, from the least specific ones since 2011, more general ones since the 1980s. And this happened because we had a national committee within the Ministry of Health And so the formalization of this happened based on the group that was already assessing ethics in the research world. So in Brazil, that's how it started. In 2024, a law was enacted about research and includes biobank elements, our law, okay? And so we started with a sub legal rules and regulations, and starting last year a law was enacted, and this process happened in a very organic manner. So the experts in the field, they got together to discuss research, and as time went by, there was a development of ethics in the country, and we needed to regulate everything regarding biobanks. So each country is going to have a different movement, I believe. So the first regulations are not infra-legal, they already law. So here in Brazil, this is how it happened. But I'm not saying that other countries need to follow the same pathway. Okay, thank you very much. We have a few questions. So is this considered a biobank or just as a bank with samples? It's part of the ecosystem. We have a biobank system. And so if it is an ultra freezer to use it in the short term, 1 week, 1 month, we have an operational conservation bank for the transfer, transportation, or for that's a very interesting question because we have the biobank logic as something only being something to store samples in the long run, but we have to consider the purpose of the biobank. Some biobanks, they keep the samples for less than 1 day. They receive it, they process it, and they discard it. So what is the purpose of that biobank? Why was it created? For what kind of operation? So there are biobanks that are only going to collect the material that the researcher needs, process it, and transfer everything to the researcher. So it depends on the design of the biobank and what it is meant for. Good afternoon. Thank you so much for the wonderful presentations. How long should we have capacity building for the staff at the biobanks and for the support team? Thank you so much for your question. I have to divide the answer because it depends on, is it the first time that you're going to have capacity building in this space? So mandatorily, they should have been trained previously. 2 or 3 times a year in the first year. And once you have already established the conditions better of this person in terms of the procedures, once a year. And sometimes you can have a new procedure. In this case, you should organize a capacity building course or a training course. Perfect. From Regina Cordova, what experience do you have when it comes to the supply of samples and also the costs for a storage? Regina, in Fiocruz, we're still assessing this. In Brazil, it's not possible for you to charge any amount of money for the materials. You only charge for the storing of the materials, and you have already mentioned that. That's an important point. And so at Fiocruz, we're carrying out a study to assess the effective costs, the storage costs. So in some cases, we may charge this, but we don't have this amount preset or predetermined. So we are studying this. It's been taking quite some time. In some international studies, they tell us how this can be assessed so that you can have the sustainability of the biobanks. Thank you very much. Are there free costs or free courses for organizations that are trying to implement a biobank? I know one free system. Some systems, they use the REDCap to manage the biobank. The REDCap tool is free, but a specific tool for biobanks, Iago from the WHO, they have the Baobab tool. It's an open source tool that I know, and I only know these two. I'm not saying that there aren't others. These are the only two I know. Thank you. Another question is REDCap in line with the principles for 2026? Can we access the pieces of data? How can they ensure the confidentiality of the data? Good afternoon. Hello. In REDCap, yes, it is in line with the FAIR principles because its tools, they ensure that the data are accessible. But I'm not saying that they are accessible to all. They are not open data. They are closed data, but they can become accessible or can be accessed by the authorized personnel, This is how the access works. It is accessible, but it doesn't mean that it is open, because the research data, clinical research data, mainly personal data, they cannot be open. And it's important also to bear in mind that REDCap, when data are collected on REDCap, the data, they are not transferred, they are not stored at the Vanderbilt University. No, the data, they stay at the institution on their server, on a digital server, okay, of the institution that is registered. That's why, as the institution that requests the license to use the REDCap, the institution must have the infrastructure, the physical infrastructure, as well as the professional infrastructure to be able to use it. At least one IT professional to be the manager of the REDCap at that institution. I don't know if I answered your question. Thank you very much, Christian. Maria Inês has a question about REDCap, the security level and the reliability of the system. Can we use it to store genetic and bio data as well? I believe I have already answered that. Daiane Siqueira, would you like to complement my answer, please? But when it comes to genetic data, I don't believe so, because we don't have the IT capacity to store genetic data. But the data, the data associated to the genetic data, yes, we can do that. Daiane, I don't have any compliments. Perfect, Christiane. Your answer was perfect. Thank you. We have other questions here. Can we establish exchange programs between our countries? When it comes to the RedCap network, yes, absolutely. The RedCap software can be adjusted, can be adapted, because it allows any researcher to develop, to design their own instruments. They're in accordance with of their research design, and it adapts to any research design, to any context, and it does this perfectly. Thank you very much, Christiane. Do you recommend that these links be open source? I believe that Christiane mentioned the clinical research. They don't recommend the use of open source software when it comes to clinical research. And this is due to the fact that many open source software have not been regulated formally, and they don't meet the security requirements necessary. So when it comes to biobanks, the most important thing is uh, to see the technical documentation, proving that they are safe, that they are secure, the liability, responsibility over the data. Do they have the databases inside the institution? So these are important elements, okay? When it comes to choosing the system to manage the data. So I would not counter indicate the open source software, but it's important for you to assess these other security and safety issues and requirements. Thank you very much, Diane. Ricardo Rodriguez. Which competencies should the lab personnel and biobank personnel have and show to be considered qualified? Translation apologizes. I cannot hear Dr. Henry. I cannot hear Dr. Henry. So I was saying that the technical competencies, they have to include knowledge of certain rules and regulations, the ISO 20387, best practices for biobanks, rules and regulations regarding the security and safety of personal data, about how to handle the samples, and so how to truly and correctly process and store the samples, how to discard them, and also when it comes to the quality control. Thank you very much, Dr. Henry. We have a question from Maria Teresa. The acknowledgement of biobanks, is it recognized by the Ministry of Health or by the Ministry of Sciences? When it comes to Brazil, yes, we are recognized by our National Committee on Ethics, and it's under the Ministry of Health. And as soon as the law comes into effect, but when it comes to the support, the recognition or acknowledgement of the biobanks based on their certification, when it comes to this, not directly in Brazil. It's not done directly in Brazil when it comes to the ISO standards. Okay, thank you very much, Diane. Lenda Castro, can we have capacity building on ISO 20387? Can it be offered to other countries, and can it be offered online? When it comes to the capacity building that we can generate here at the university, we publish this on our social media, on the university social media. We have a group on WhatsApp, and if you are interested, you can join And then when we have information about these events, you're going to be able to participate, okay? Thank you very much. We are interested in my country to have a tumor bank. We are working on a project. We're going to start with a pediatric hospital. And we are going to have samples from all kinds of pediatric tumors, okay? And all of these samples must be studies, and this is important and relevant, okay? This is a comment made by Ana. In Argentina, we have recommendations on how to manage biobanks. A question for Fiocruz from Maria Teresa. Do you receive any state subsidies for the biobanks? Fiocruz is a federal agency, so most of our resources come from the federal government. So yes, we receive funding from the federal government for implementing biobanks. Okay, an anonymous question. So we have had positive COVID-19 samples since 2019. How long can we keep them stored, and when should we discard them, and how should we discard them? There are a few protocols for these topics regarding the discarding, how long you can store these samples. I'm going to leave some links here in the chat so that we're not going to spend too much time answering this, but I'm going to leave the links in the chat box, okay? We have an anonymous question. Can you recommend references, bibliographic references, so that we can prepare ourselves for responses in case of accidents and incidents? Yes, we have documents on ISO 20387. We have a manual that was created by the WHO, and they have chapters and pages dedicated to how to respond to incidents.
Now, a anonymous question as well, if there is any specific certification for biobanks in Peru. No, actually, there is not. Sarita asks, what's the future of biobanks and how the new technologies are being adopted? New technologies and investigation trends. Nowadays, we talk about biobanks and its evolution. We had biobank 1.0, now 2.0, now 3.0, and then in version 1, we talked about the quantity of biological material. In the second version, the quality of the biological material was the question, and the third version is the use according to the purpose. So no need to have a big inventory if there is no need, and with the biobank 4.0, so there is this issue of how to use AI, how to work better with data, how to datify processes. So discussions on the future of biobanks have to do with this, how to improve processes, how to automate more, how to digitize more. So it has to do with the future of biobanks. Thank you, Diane. Rafi Kaylee is asking, well, thank you very much for the excellent presentations. Could you tell us how to communicate with research institutes, research and education institutes, so if they have available samples to help us with in our investigations? institutions usually have their catalog of biological materials. So I suggest that if you already have a partnership with some institutions, so you could search for any catalog of biological material if they have that. And over the last years, there have been some international tools available, and institutions worldwide are including those in their catalogs so they can have better access to them. Thank you very much, Diane. And now the last question. What is the precipitation in terms of risks for the human material, and what is the norm that will define this classification? And would you like to reply to that? Biological risk. This is considered as level or risk or group 2 in this case. Thank you very much, Henry. Now we're going to go to the closing remarks by Dr. Cynthia Hurtado. Thank you very much, Angel. Yes, we've got to the end, and we have had 40 questions. This is a record. Actually, this is the third webinar in this framework of cooperation of Global Health Network, Latin American and Caribbean, Universidade Peruana, Caetano Heredia, Fundação Oswaldo Cruz, and Universidade Científica del Sur. So this being a landmark in our cooperation in our region. I would like to thank each speaker for their dedication, for their time, and the clarity with which they have shared their knowledge throughout this period. And thank you for Dr. Cristiana Bressani, Mersan Huser, all the speakers for their valuable contributions. I would like to thank all the team that is behind the scenes here for their technical support. Carlos Manrique, Guilherme Otique, Lónica Lopez, Soledad, Marisa Silveira, and the Fiocruz team just as well. Your work has been crucial in order to make it possible. I would also like to thank everyone that has been with us this morning. And I would like to invite you to keep in touch and participate in the research activities in Latin America to contribute to this bioethic and biosecurity culture in our investigation activities. So thank you very much and have an excellent afternoon. Thank you. Thank you, everyone. Bye-bye. Bye-bye.